was always going to be the case, wasn't it, that a pandemic comes along, and to use a Buffett expression, you only know who's naked when the tide goes out. The tide's gone out, and it's shown that the American healthcare system simply couldn't cope with that pandemic. It handled it appallingly. Is that another aspect of this privatised system, that it can't respond to a pandemic or a national health crisis such as the one we've had?
It's not designed to. It's designed to make money. So if you want to invest in preventative care, you need surplus capacity. What have we been doing? We've been cutting capacity. If you want not to make a profit, if profit isn't your primary goal, you do things that might stop the spread of the infection. You may support people to isolate. You may have an effective test and trace system. You may fund the public services that are already existing. What has our government been doing for the last few decades? Exactly the opposite. The 2012 Act undermined public health in this country. They sold off the public health labs. They made redundant the very organisational memory that we need. Experienced epidemiologists, public health experts, they all went. Even the government's own exercise, 2016 Exercise Cygnus and Exercise Alice, in terms of pandemic preparedness, they were ignored because that would require investment in the public service. That doesn't fit the political agenda, which is to shrink the state, to shrink public provision, and to force people into the private sector. Now, you do not do that by providing a good service. Right. You have to undermine the service. Right. And I think the problem we have is getting across to the public that our government is willfully making their health service worse, willfully causing preventable harm and death in order to get a political agenda across.
So it's all ideologically based, this?
Ideologically, and also very profitable for those politicians who have their snouts in the trough.
So it's no surprise to you that the Royal College of Emergency Medicine, that report, what was it, 4,500 preventable deaths? Yeah,
so they looked at the effect of overcrowding. Why do we have overcrowding in hospitals? Because we don't have enough beds.
Why don't we have enough beds? Because they're underfunding the service.
We've lost 20,000 beds since 2010. So the austerity program of cuts has led to overcrowding. Sick people don't have a bed to go to. So people are waiting in the backs of ambulances, not getting the care and supervision they need. That means they are preventably harmed or dying. Whilst that ambulance is waiting to drop off patients, there are people waiting at home, seriously sick, not getting transported to hospital where acute care, important care, life-saving care can be provided. So what happens in that circumstances? People die.